Let's now tell you about the symptoms of cervical cancer. Important to know that many patients of cervical cancer, especially in the first stages, may not see any symptoms. During the advanced stages, some of these symptoms can appear. Vaginal bleeding in between periods. Vaginal bleeding during sexual intercourse or after sexual intercourse. Vaginal bleeding sometimes even after menopause. Discharge from the vagina having a small odor. Sometimes the discharge may also have blood spots. Let's now bust some myths around cervical cancer. First of all, cervical cancer is hereditary. That is a myth. It isn't hereditary at all. It is caused by a virus that infects an individual and isn't something that gets passed on through the generations. Patients of cervical cancer cannot become pregnant. That again is false. Patients suffering from cervical cancer can recover during the course of the treatment, can let their ovaries be set aside during radiation, and once they are out of the situation, they can conceive. There are several fertility treatments available for them. Another myth associated with cervical cancer is that you need to get an HPV and a pap smear test year after year. That isn't correct. Once in 3 years is good enough once you are clear. Also, there is a myth that multiple partners, people who have multiple sexual partners, are the only ones getting cervical cancer. Well, that definitely increases your risk. However, many people with single partners also get cervical cancer.